Lower back pain, stenosis, and sciatica are the second leading cause of conventional doctor visits in the U.S., but unfortunately, their conventional approach only addresses the symptoms, allowing the condition to progress to the point of no return, which is usually surgery. Today, we're going to open your eyes to cutting-edge technology that addresses each and every part of your condition, the inflammation, the mechanical issue causing the inflammation, and retraining mechanisms to correct the underlying problem and not just the symptom. Let me ask you a question that maybe nobody has asked you before. Are you happy with the current state of your spinal health? Are you happy with the care you're getting at your doctor? They are supposed to ask you about this when you go to your doctor, and the answer is supposed to be yes, you are happy with your spinal health. But statistically, 90% of people who suffer from spinal problems are relying on medications or injections to manage their back pain, sciatica, or stenosis. What if we could offer you a better way to treat your condition and improve your condition by 60 to 100%? Would you like that? Let's get started. Here in this video, you see a human spine and spinal cord. In order for our brain to communicate with the rest of our body, it sends signals down the spinal cord and out to nerves which emerge between the vertebrae. In between the vertebrae and your spine are discs. The discs are supposed to be healthy and thick and protect and cushion those nerve canals that the nerves themselves emerge from to go to your muscles and organs. In the case of spinal stenosis, sciatica, or back pain, it can be a sign of breakdown to the spine, the disc space, and the spinal canals. Here we see that when spinal discs start to break down, the inside of the disc can actually protrude and compress the nerve root that's emerging from between the vertebrae. If the nerve root is compressed at the spine because of unhealthy discs, it can cause pain in the legs, arms, or even headaches. The same nerves that emerge from your spine to go to, for example, the muscles in your legs, also go to other organs. Those same nerves go to the digestive system, the reproductive organs, and the bladder as well. So compression of those nerve roots because of an unhealthy spine can actually lead to other health concerns besides just pain. Spinal pain is one of the most common chronic degenerative diseases in the United States. Up to 80% of the U.S. population has experienced back pain at some point in their lives. Back pain, stenosis, and sciatica can occur at any age, but they're most common among middle-aged and older adults. Back pain is the second most common reason that people visit doctors' offices. Americans spend at least $50 billion each year on back pain treatments, showing just how debilitating and also how common this condition is. Are you like many people with back pain, and you're just tired of taking medications to manage your condition? The information we're about to tell you is not intended to scare you. We just want you to understand how much relying on medications to manage your back pain can affect your health. Most of the information that we're about to present today comes from the Centers for Disease Control and the World Health Organization. We believe it's your right as a patient to be fully informed about the medications you're putting in your body and how they might affect you, so you can make an informed choice about whether you want to use them. Here at the clinic, we like to say, if nothing changes, then nothing changes. And what do we mean by that? Well, if we don't start doing different, then we're going to get the same result over and over that we've been getting before. Spinal pain is a chronic degenerative disease, meaning it progresses and it gets worse over time. There are no medications that slow down spinal conditions from progressing or that reverse them. If you're taking medication and you've been doing it for years, decades even, what could possibly change? What we typically see is a downward spiral where the patient's pain gets worse, they take medication to manage their pain, the medication doesn't work as well because the condition is worsening the whole time, they get prescribed higher doses of the medication, and so on until the condition is so bad that it requires surgery. This is a picture that comes from a veterans magazine, and it describes our typical medical standard of care. It's funny because we all know what this picture means. In the U.S., our healthcare system is really set up so that for every symptom, we have a medication for it. We've created a system that is a reactive system. It's very rare that it looks at the underlying causes of a problem. Instead, it just prescribes a medication to treat the symptom. In the original magazine accompanying this picture was an article about how we're in a healthcare crisis in the U.S. Do you feel that we have a healthcare crisis in this country? It also talks about how we have an insurance crisis. Our country's health is going in one direction and the insurance coverage is going in another. We have been bombarded with chronic illnesses, and there is no medication, injection, surgery, etc. that will correct a chronic condition. Our healthcare system was originally built off of an acute care model, which means that if you get an acute condition, such as getting the flu, breaking your arm, or having a near-death experience, that's what our healthcare system is really good at treating, and that's what insurance coverage reflects. But they're not so good at treating chronic conditions. Now they're trying to force many chronic conditions that Americans suffer with into this acute care model, which is treated with drugs, surgeries, and injections. And it's very obvious from the statistics, as well as from the personal experience of patients, that this is miserably failing. Low back pain, spinal stenosis, and sciatica are among the leading chronic degenerative diseases in the U.S. Billions of dollars are spent every year on surgeries and medications. But the problem we have with treating back pain is that we rely on drugs, surgeries, and injections to try to fix mechanical problems. It's like using duct tape to try to hold up a house that has structural problems. All of these things are acute care approaches, which means emergency care. Lower back pain, stenosis, and sciatica are chronic degenerative conditions that require a systematic approach to correct. These are degenerative and structural conditions that get worse over time, meaning they keep progressing and they're not corrected with our current system.
The American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, I probably get paid $1,500. For me to spend 45 minutes with a patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problem society's having.
Soldiers' use of prescription drugs has tripled in the past 5 years.
The medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, we're talking about the health of the nation.
I'm sure you don't need us to remind you that each medication you take is accompanied by a host of negative side effects. When you watch a commercial on TV for a pharmaceutical drug, sometimes more than half of the time in the commercial is taken up by the laundry list of side effects that they have to mention. We are not saying to stop taking medications if this works for you. There is a time and a place for medications. The problem comes in when we try to rely on them to treat chronic degenerative conditions, and this is like fanning away the smoke without putting out the fire. The condition is still getting worse. The medications are just masking the symptoms. If you go on WebMD, you can look up any drug that you might be taking, and you can find a list of the side effects so you can be informed about the risks and benefits of taking these drugs. We are not saying to stop taking your medications, but using them long-term is never the ideal solution. If there's another way to treat your condition that would get you off of relying on some of these medications, obviously that would be a better solution. Surgery also comes with risks, and long-term, most people get funneled down the path to having back surgery in the conventional medical system. But did you know that 74% of back surgeries fail long-term, meaning that they may give some pain relief at first, but most of them relapse? There is a lot of overlap between what is treatable in our clinic and a patient that's on the way to being cleared for back surgery by an orthopedic surgeon, meaning that we've had patients being told they need surgery and we were actually able to stabilize them back to their daily function. You have to remember that most conventional medical practitioners only have a few tools in their tool belt to treat the problem. Medications are usually the first stop and then surgery is the next, but there are other alternative options out there. Let's switch gears for a little bit. If I told you that most people actually treat their bodies worse than they would treat their car, would you believe what I was saying? Well, let me ask you a question. What if your check engine light came on in your car? What would you do? Well, most people would say they would take it to the mechanic, and then the mechanic would pinpoint the internal problem and they'd fix it, and the light would go off because the internal problem had been fixed. But what if I told you that the last time my check engine light came on, I drove it to the mechanic and asked him to just reset the light for me so it didn't bother me anymore while I drove? That doesn't make sense, does it? But this is exactly what we're doing with our lower back pain, our sciatica and stenosis. We take NSAIDs, pain pills, addictive medications that have lots of side effects. We get steroid injections, all so that the symptoms go away, but we never address the underlying cause. Those symptoms are like our body's check engine light, telling us that there's a problem that needs attention, and we can't just ignore it because, just like with our car, it eventually will lead to a breakdown. Our spines are a lot like a car. In order for a car to operate and function properly, it needs a few things. The first thing is proper alignment. If our alignment is out, the tires are going to wear easily and will blow out. There's also going to be wear and tear on the parts around the tires because they're picking up the slack. 9 times out of 10, this is actually exactly what's happening with the spine. The spine has shifted and has lost its spacing between the vertebrae, or your disc is actually bulging onto a nerve, and that's causing your symptoms. Malpositioning of the spine will cause long-term spinal problems if it's not corrected. 2, your car needs proper oil and lubrication systems that allow the engine parts to move properly without wear and tear. When your spinal discs are dehydrated, it causes your spine to shift, decreasing the movement and collapsing it onto your nerve. Our cars, as we use them, do start to break down, but if we've maintained them properly and we fix short-term problems, our cars can last us a really long time. The same goes for our spine. Over time, life is hard on our body. Certain parts of our bodies, such as our spine, start to break down. So when that happens, it's very important to take care of the problem before it creates other problems down the line or before it gets to a point of no return. Our symptoms might really bother us, they might be really painful and uncomfortable, but the truth about symptoms is they are like your body's alarm system. They're actually something to be grateful for. It's like a check engine light that's coming on in your body telling us that there's a problem that needs some attention. So the next time you have back pain or burning pain in your feet or legs or sharp stabbing pains down your legs, or it feels like your back or your legs are going to give out, if you maybe have pain in your neck or arms or numbness, tingling in your hands, if you're relying on medication long-term to suppress these symptoms, that is actually like taking a piece of tape out of your glove box and covering up the check engine light that's come on in your car so you don't have to look at it anymore. What's going to happen over time is that your car is going to break down. The internal problems that are causing that symptom are going to get so bad, they're going to grow and then finally lead to a failure. This is exactly what we usually do with our spinal health. There is a time and a place for medications. We have to live our lives, but putting a Band-Aid on spinal problems with medications is going to get you into a situation where you're headed towards a point of no return. At that point, you won't be able to walk, sleep, exercise, relationships would be affected, or even it could get so bad that it's not treatable except for the acute care model with drugs, surgeries, and injections. Thinking this through, we all know that that's not the approach we want. If there's a way to treat our condition without relying on the conventional model of drugs, surgeries, and injections, that's actually a very exciting thing. And if your body could talk, it would probably be saying, "Yay, thanks for listening to me. I was telling you there was a problem, and you listened to me." 74% of back surgeries fail in the long term. You actually have a much better chance of returning to your normal function by not having back surgery. There is a 41% increase in opiate dependency, people who have to take pain-killing drugs to function, in people who have back surgery. In the last 10 years, deaths due to pain-killing drugs have actually been on the rise. Some back surgeons say that back surgery is an empty promise, and this just shows how serious this problem is. One of the other reasons we're so serious about spinal problems is, as we get older, if we let these problems go on for long periods of time, we have to worry about instability and falls are actually one of the leading causes of death among older people. In the conventional medical system, you're usually presented with two choices, neither of which is really that great. The first one is go to your primary care doctor and get some drugs to mask your symptoms, or the second one is get referred to an orthopedist for a back surgery evaluation. You might get prescribed rehab or medications just to be put on the track to the surgery process. You might hear, you have to take medication, or you might hear, nothing else can be done. Well, we're here to tell you today that these statements are absolutely not true. Once you start addressing the underlying cause of the condition and fixing it, the body actually knows exactly how to repair itself and get you back to enjoying life again. The Blueprint clinics across the country are helping people with low back pain, stenosis, and sciatica, just like you, every single day. The way we restore spinal function is by addressing the root cause of the spinal condition. We take a comprehensive approach to treating back pain, sciatica, and stenosis, and we feel very strongly that the best outcomes are a result of addressing the root cause of the condition. A critical and unique part of our treatment plan involves a series of comprehensive treatments that put the body back into an optimal position to heal itself. The body knows exactly how to heal itself. Sometimes it just needs a little bit of help. We go out and look for the newest cutting-edge technology and research to treat back pain. We've found that if you attack back pain and degeneration from every angle and you leave no stone unturned, about 85 to 90% of our patients get the results they're looking for and get better. So at this point, let's revisit our spinal anatomy and the degenerative process. Ideally, the spine allows the nerves to function. If our problems are compression at the spine, which is narrowing the nerve canals where they emerge, while decreasing movement of the spine, and all of this affects the nerves, wouldn't it make sense to decompress the spine, rehydrate the discs, and allow those nerves that run down our arms or legs to reestablish their function again? Seems pretty simple, right? Well, it is. When we think about taking a medication, receiving an injection, or going through putting metal rods or cages in our spine to keep the nerve canals open, it's apparent that this is the wrong path to take. There is a simpler and better solution. So let's move on and cover what's going to get you healthy again. Back pain, stenosis, and sciatica are conditions that require treatment of all the damaged areas. Fortunately, we have developed a 3-part therapy regimen, which has shown great results for our patients. We have to treat all of these 3 areas in sync in order to correct the condition. One of the treatments we use is called low-level light therapy, or it can also be called laser therapy. Low-level light therapy stimulates something called angiogenesis, which is the creation of new micro blood vessels around damaged areas that bring in the nutrients and oxygen that those areas need to heal. Low-level light therapy stimulates the production of a protein called vasoendothelial growth factor, or VEGF, which is a signaling protein that's responsible for stimulating angiogenesis. There are thousands of studies that support the efficacy of light therapy. Light therapy reduces pain, it improves immune function, it speeds up healing of wounds and fractures, and it increases the production of everything the tissue needs to grow and heal. Low-level light therapy has been FDA approved since 2001. The next step in our process is re-educating your nerves and muscles. Now, what do we mean by that? Well, when nerves and muscles have been inflamed, they get weak and they forget how to work properly. So we have to retrain them back to normal. We have a device that sends signals to the muscles and nerves, electrical signals that help shut off the pain, allowing the inflammation to subside and increase the function of the muscle, helping decrease the degeneration process and reestablish communication between your brain and your spine and your muscles and nerves. That's going to get you back to where you need to be in order to recover. Lastly, we use a cutting-edge technique called disc rehydration therapy. With disc rehydration therapy, we're creating motion directly in the areas of the spine that are causing nerve compression. With this motion, we're increasing hydration of the disc. We're also making endorphins for pain reduction. And we're also increasing the sustained motion of the spine to reverse the aging process of the spine, and the spine is going to be decompressed. This is a crucial part of our treatment program to restore function back to your disc and really to your whole spine. And of course, for our tissues to really repair themselves, we have to address the levels of inflammation in our body. This is part of being able to bring blood flow to the damaged areas for the healing effects to occur. We have a protocol that will help you control your levels of inflammation. And the way this works is we have nitric oxide, which is a natural vasodilator that helps improve our circulation. However, the typical American diet is very high in sugar, starches, and carbohydrates, which creates actually a decreased production and efficiency of nitric oxide, leading to problems in opening up our blood vessels and creating that blood flow. Inflammation results in decreased blood flow, and it also increases pain. And so what we want to do with our dietary modifications is have the goal of getting our nitric oxide levels up and getting our inflammation levels down. We are going to give you some exercises that you'll be able to do at home that are going to address the stability and the flexibility of your spine, and they're going to rebuild and retrain the muscles, ligaments, and tissues around your affected area. These are very easy, light movements. You can do them right in the comfort of your own home through our automated rehab service. Restoring your spinal vitality needs a comprehensive approach. It cannot be done with a simple pill or a surgery. Because there's so many factors that contribute to low back pain, stenosis, and sciatica, a comprehensive approach is needed to correct them. So what we have for you as part of our treatment plan is laser therapy, which stimulates your angiogenesis. We have electrotherapy, which is going to help your brain and muscles and nerves communicate with each other and retrain the nerves. We have disc rehydration to help increase your movement and range of motion and get the inflammation down. We have the anti-inflammatory diet protocol, which is going to decrease your inflammation, decrease your pain, and stimulate healing. And then we have, finally, our home rehab exercises. Now, we do all this because we believe that addressing spinal problems from all different angles is really the thing that's going to help you have a long-lasting and speedy and stable recovery. The number one thing that's going to underlie your entire recovery process is your motivation. So we want to ask you right now to think about this. What is your motivation? Because your motivation becomes our motivation. Do you want to be active without pain? Do you want to be able to play with your kids or grandkids, for example? Do you want to be able to just walk around the block? Are you aware of the downfalls and risks of surgery down the road and you want to avoid them? Any of these things or something else could be your motivation, but it's very important to find your motivation to help guide you and inspire you through this whole process of healing. Okay, so now that we've learned about the causes and the treatments for spinal problems, who is it that should come in to see us at the clinic? Who might we be able to best help with their back problems? If you have any of these symptoms, I'm going to read them off here. If you have any of these symptoms, spinal pain or stenosis, if you have instability in your spine, or if you have sciatica, if you feel sharp electrical pains going down your legs or arms or other parts of your body, if it hurts to walk, if you can't be active anymore, you can't do the things that you used to enjoy doing, if you can't sleep from back pain, if it wakes you up in the middle of the night, or if you're afraid you might be heading towards surgery, you should come see us. But most of all, we want people who are serious about getting better. So if you have any of these symptoms, or maybe more than one of these symptoms, and if you're really serious about taking your health into your own hands and you want us to help you with that process, then we are absolutely here for you, and you should definitely come see us. Now, who should not come in for an evaluation at the clinic? Well, if you're looking for a quick fix, or if you don't want to take the time and really invest into your health, then you should not come see us. You are not the right fit for us. We are looking for people who really want to get better, and we are extremely confident and competent at what we do. We don't take recommendations from outside sources. We do our own research, and we find what works best for our patients. And that's why so many of our patients get the great results that they're looking for. We're looking for patients who want to make a commitment to their health, and you're going to have to meet us more than halfway because this is your health. It's your body. You have to live in it. We have a program that will help get you better, and we will be there along the way to support you in all that you're doing. But you have to be committed, and as long as you have that commitment to yourself, you can expect to get results. Okay, so what would you expect if you do come into the clinic for an evaluation? Well, first you're going to apply to be admitted, and the reason for that is we don't accept everybody into our program, but we need to get to know you to figure out if we're a good fit. You're going to have a consultation. We're going to go over your health history. We're going to do a thorough exam to evaluate your condition, and we're going to present you with a report of our findings. If you have a spouse or significant other, or if you have someone who you make decisions with as a team, we would like them to attend your visit too. That way, when we go over the recommendations, if you make decisions of this nature that involve time and financial and health commitments with somebody else, we found that it's very beneficial for everyone who's involved in that decision process to attend. Declining spinal health is a very serious condition. We want to understand your condition, what it's going to take to get you better, and we want to all sit down with everybody who's involved in the process and supporting you and make a decision together to see if you're a good candidate for our program. We have a very high success rate, and that's for a reason. It's because we're so careful in our acceptance process, and we really want to take the time to make sure. Spinal degenerative pain is a condition that gets worse over time. So this means that waiting to treat it is not the best decision. It is going to get worse if you do nothing or if you continue on the same path that you're on. Now, this next video makes it really clear that there's two paths for our health. It's a perfect description of which way life can go. So as you watch it, we want you to know that we are here for you. You are in great hands with the practitioners who are using this program. It would be silly not to take advantage of our evaluation process and see if we can help you.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
Thanks for watching. I hope that you've learned some valuable information. I want to share with you a very special offer from Dr. McKay. It is really simple. All you need to do is click the special offer tab. You will go to our homepage and you will see me pop up with all of the details. I'm certain you're going to like what you hear. So click the special offer tab and look for me on the homepage. You'll be glad you did. Thanks.